welcome to your clear aligner treatment. I'm Dr. Vandana Katyal, the orthodontist behind this, and I'd love to take you through today like an orientation about your clear aligners. So I'm just going to start a presentation and we're going to go through this bit by bit to get you ready for your aligners to come, okay? So by now, you would have received your treatment instructions, possibly an email from the app called Dental Monitoring, your Invisalign movie that kind of shows you step-by-step process. If you're on Spark aligners, you also might receive a movie via Spark. So congratulations, lovely to have you as part of our practice, and thanks for choosing us. I'm just going to walk you through a few things about your treatment today, okay? So firstly, when you start your aligners, it is okay to feel a little bit weird and lisp a little bit for a few days and just have some mild discomfort. So it's much different to braces though. The pain levels are a lot lower. So you might find that you may not need a painkiller. But look, for the first few days, if you feel that your teeth are a bit tender or it's rubbing anywhere from the time you start wearing an aligner, it's okay to have a painkiller, whatever you're allowed to take by your medical doctor. So you're going to receive a packet or a box of aligners. We don't just give you one at a time, we give you a series of them, and each aligner will actually have numbers on it. So you're always supposed to wear them in a sequence starting from 1 all the way to the end, okay? The last number here on the aligner, number 23, for example, is your final number, but never think final means this is where your treatment finishes, because we often need extra set of aligners as we go through treatment. Your bolded number, so for example here, number 17, is actually the current aligner number that you're wearing. Each packet is resealable. We always ask as you're progressing through your aligners, a lot of times we ask you to change them weekly. Sometimes we will say 10 days, sometimes 14 days. So it depends on your particular case. But say if you're changing them weekly, do not throw these bags away. Try to hold on to at least 4 or 5 previous aligners. Sometimes we might have to go back in treatment. This is what your aligners look like. So they're almost clear, transparent almost trays that you literally put on like you would put a glove on your hands, like a best fit, and then push. Now, if you ever feel that you don't know what number your aligners are or you got confused, these little red circles are showing you this tiny prints on your aligner in a special black ink that actually shows you little letters. You have to really place it against an opaque background to even read them, and they're very fine, but they say something like U01N, which means upper aligner 01 is the number. Okay, and the lower will say L01N. So depending on what number it is, the aligners also have a little print on it. The biggest thing for your aligner treatment is something that we recommend called chewies. Chewies are these little squishy little rolls. Then they are almost rubbery, and they often come flavored, so kind of cool to chew on them. But what they really do is seat your aligners really well. So aligners work beautifully if they're always fitting on your teeth as best as possible. So what are the ways to make them fit better? Number 1 is to wear them 18 to 20 hours, even 22 hours if you can. So your wear time is critical. Number 2 is doing these chewies. So if you could do this biting on your chewy every time you put your aligners on after a meal, or if you can do it 5 minutes a day while you're sitting and watching TV, it really makes the movements more predictable and the aligners progression much easier for you. So don't forget these are integral. Each chewy will last you 2 to 3 weeks, depends, and you're supposed to bite on them from back to front. So make sure you're holding them in your hand and going bite, bite, and it's okay to bite strongly with them because they won't hurt you. You also will receive a CCC Smiles goodie bag that has many things for you. This is a pull tool or aligner remover. Some people will use their hands, but some people will use this tool. So whatever you prefer, that's okay. It's got a plastic hook, which means that it doesn't really irritate your gums or cause any damage if you're removing them. You've also got plenty of chewies that we supply you, and if you need more, we can give you more. As I said, this is a very important part of your treatment. You will get an aligner case from us, and this aligner case is good enough to hold a chewy, 2 trays, and you can also have your pull tool in it. So everything that you need is in this slim little case to carry around. You can even put some rubber bands in it if we've told you to wear rubber bands. You also receive a travel toothbrush and toothpaste from us, an emery board. These are like little nail filers that help to buff the ends of the plastic aligner in case they are rubbing. Usually your aligners will fit really well, but every now and then, an edge might just rub a little bit more than usual. So if that's happening, just get your emery board out and just buff it down where it needs to be done. Now you may need some aligner cleaning crystals. These are only in case you have to stay in a particular aligner more than 10 to 14 days, because aligners do get a little bit yucky. Another thing you could do is use white vinegar and water, a 50-50 proportion, and dip your aligners for 15-20 minutes in it. They come out really fresh. The cleaning crystals are just samples, so just hold on to them. And if you ever need them, they're like a packet of aspirin powder. You just basically dissolve it in a cup of cold water, throw your aligners in for 15 to 20 minutes, even up to 30 minutes, and then take them out, and they do look pretty cool, brand spanking new. So wearing your aligners is pretty easy. Like I said, it's like fitting a glove on your fingers. You just got to get the best fit and then push up. Generally, you'd push the front first, and the aligner is actually quite flexible. So don't be afraid to flex it and get it right to the back and front. So some people I often observe at the start, they're very afraid to even hold the aligner, and they're being very delicate. Now, you don't have to be too rough, but the aligner is pretty sturdy that you can push, flex it in, push it up, so to get the best fit. It's actually quite easy to put them on. Now, to take them out, you can use your fingers. Often go on the insides of your teeth rather than outside, because a lot of times your attachments are on the outside. So use your finger or your pull tool with the elastic hook, with the plastic hook, sorry, and go to the back, go dislodge the backs first on the inside surface, okay? So like the depiction here with the fingers, just imagine using either fingers or using your pull tool, and then easing it gently to bring it down. So never try to rip them from one side and try and get them off really quickly. That's when they can fracture or break, okay? So easing them off. So here Josh is going to show you how to put the aligners on, and in case we've told you to wear elastics, he's also going to show you how to wear the elastic, and we'll go through that in a sec. So let's watch it.
Hi Josh. Josh, how are you?
I'm pretty good.
So Josh is wearing his Invisalign teen aligners. He's on number
14.
And he's going to demonstrate how easy it is to put them on, take them off, and wear rubber bands.
Okay, so you get your bottom aligner or top. You want to put it on the bottom with the bottom.
Sorry, we're going to zoom in a bit here just to have a look.
And all you need to do is just stick it in like that. Get the other one. You just put a little pressure on it. It's all good.
And can you demonstrate your rubber band wearing skills today?
Yeah.
So Josh is supposed to be wearing rubber bands all the time.
You get 2 rubber bands. They're very small, as you can see. And you just get it on top of your hook that's on your Invisalign. Get it around it. Pull it down onto the attachment.
Wow, that was quick.
Yeah, it's really easy.
So as Josh is showing the elastics and putting process, quite easy, yeah? You may not have elastics for your treatment, but in case you do, there could be a different direction to this, but generally you have a little hook on your aligner, which will show you. You have a little button somewhere to attach it to, and you just stretch the rubber band like Josh just showed. But we'll go through that with you when we see you. If you need polishing, often we'll begin with a light, gentle polishing between your teeth with this thin little metal strip. It's very safe to do. It's relatively painless, and we do it gradually and gradually. All you feel is like the floss going in quite easily and nicely between your teeth. You don't really see a difference in the shape of, in the size of the teeth visually, although slightly they're being slimmed down, but you cannot even detect it visually. Now, attachments are necessary. This is probably the worst picture of an attachment, but they don't really look that big and ugly. But actually, attachments are often necessary. We try to avoid them right at the front, but sometimes we need them. And, they come and go throughout your treatment. So sometimes we'll have them on for a few months. Then we may have to remove some of them or change them. They're tiny little white blobs that are stuck on, and they eventually wear down. They're not really that rough. So if you break or lose an aligner within your prescribed wear schedule, well, usually you just skip to the next one in sequence for both top and bottom. In case that is your very last aligner, then make sure you have a previous one somewhere at home very safely, because you're always supposed to have an aligner on your teeth so teeth don't go back all the way to zero. So if you can't find an aligner forward, go to one previous if you break or lose one. Maintaining oral hygiene, very easy. You're brushing your teeth twice a day at least. So make sure you're giving your aligner a bit of a nice scrub with your toothbrush and toothpaste as well. They only last a week, 10 days, maximum 2 weeks. So you do dispose of them afterwards. They're not recyclable, so make sure you throw them in the household bin. Diet really doesn't have to change unless we've told you particularly for a reason, but you just remove your aligners, bite onto anything you want, eat whatever you want. That is completely okay. Although aligners are always on your teeth, you do remove them for eating and brushing. The only thing you can drink with them in is cold tap water. Or even sparkling water is probably not a good idea because it's got fizzy stuff, and anything fizzy is a bit acidic. So we really don't want all the fluids that you drink with aligners in seeping in and then staying next to your teeth for extended periods of time. Some people have asked me if they can sip a coffee with them in. It's best not to. It's really important to remove them. This does make it quite difficult because you're going to have to snack a little bit less and eat bigger meals. Maybe that's a good thing for you. Maybe that's a bad thing. But in terms of removing them and eating them, if that doesn't keep bothering you, removing them over and over again, cleaning your teeth or rinsing your mouth out in water, and then putting them back on, then they are hygienic. They are really hygienic, much better than braces in many ways. So you've also got a do's and don'ts comparison here, which is in your instruction booklet as well. Basically, in a nutshell, you've got to wear your aligners in a sequence. You've got to wear them about 20 to 22 hours a day. You're going to brush them daily, keep them clean. You never put them in a tissue and put them somewhere because you will easily lose them. Always have your case on you. You can drink water with your aligners in. Chewies are integral part of your treatment. Biting on those chewies every day for 5 minutes is really important. You continue your routine general dental checkups with your dentist. Any fillings that you may need, just take your aligners with you so the dentist can make sure the aligners are fitting after any treatment has been done. Now, things you don't do is don't throw away your aligners until we tell you to. So keep all previously worn aligners back in their bags and seal them again. Don't leave your trays out of your mouth for too long, because you will find every time you put them in, they might feel a little bit of pain because teeth are moving back to number 0 again, okay? Chewing gum with aligners, big no-no. If you try it, you'll see it is horrible and your aligners get stuck and it's very hard to remove the chewing gum from the aligner itself. Don't leave your aligners in a hot car, in hot water, anything with a lot of heat around it, because they are plastic, they can distort. Don't leave them around pets. Pets particularly attracted to the smell of aligners and will go find them and they will chew them out. So put them in a safe drawer. Any major dental work that's needed during a treatment, just touch base with me, because we may be able to facilitate it during a treatment, okay? But just make sure you're connecting with me about it. Please don't use mouthwash with aligners in, and you're not supposed to really keep biting hard on your trays all day. That can cause facial pain. So just, you know, put your aligners on. It will feel a bit different. There's a bit of thick plastic between your teeth now that never used to be there. It'll take, you know, 1 or 2 weeks, but you'll adapt to it. So quickly, now we're going to get to the dental monitoring part. But dental monitoring is this app that helps us detect week by week how your treatment's going. So you're going to get these special blue retractors, and also the goodie bag comes with you. Now, if you're traveling, make sure you take your retractors for dental monitoring with you, and also make sure you take extra few aligners just in case you lose them, okay? Now, this is dental monitoring. So you will learn to do these 3D videos, or called dental monitoring scans, with your smartphone, okay? There's a step and a procedure to it. We will show you this in the clinic when you come and see us, or you could practice them yourself virtually. So this is really a lady showing you how she's doing it. Please note how she's really pulling on the retractor on both sides, on one side first, and then as she turns her head, she's pulling the other side now, so we can really see all the back teeth as best as possible. Okay, so what dental monitoring does, this is a fancy chart, but what it's going to do is basically it's going to tell you, remind you. It's like a reminder. So we set it based on what we believe is your best schedule. You may be 7-day changes, you may be 10 days, you may be 14 days. We don't know yet. Everybody's different. So say you were starting on a 7-day change, right? The very first aligner you put on, you take your dental monitoring scan with your smartphone. You wait 12 hours, you'll get a response from us, 12, maximum 24 hours, and the response could be 2. It could be go, which you get a green light, or no go, which is a red light. So go means, hey, you're good to change to aligner number 2, progress, okay? So you just put your aligner number 2 on, wait for the app to remind you in a week again, it unlocks, you take your video again, wait another 12 to 24 hours for us to tell you what to do next. So don't change your aligners until we tell you. Now, if you ever get a no-go, a red, we say do not change your aligners, stay in your current aligner. Firstly, do not be worried about it. This is very common. There's times when we slow down your treatment and we go a bit slower to make sure the movements happen as best as possible, okay? And there's times that we detect something not great and we will say, no, you're not ready to change, just spend an extra few days. So if ever we give you a red light, no go, nothing to be worried about. It's very normal. In fact, it's a good thing because we know that it means your movements that we've programmed most likely will happen more predictably if we slow you every now and then. So if you get a red no go, just don't change your aligner. Wait for your app to unlock and remind you. It will send you a notification and an email, and it unlocks in about 3 days. And then you scan again. Then wait 12 to 24 hours. We'll tell you whether you're going to change or not. So the app continuously is a great auto-adjusting sort of a reminder for you. You never have to worry about putting calendar reminders anymore, okay? And they are monitored in the background by us. So what really you're going to do with your smartphone monitoring with the aligners, you're going to take 3 different videos for us, and we'll show you this in a video. You're going to first put your aligners in and have your teeth slightly apart, and then take the video. Then you're going to take your aligners out and bite with all your teeth at the back touching, and then again take your smartphone. And lastly, you're going to again have your aligners out, open your mouth a bit wide, and take the top and bottom shot with your phone. So let me show you this video, okay? So it makes it clear how you're going to take it. So that explains the process. Don't be afraid. Dental monitoring is easy. We have so many patients and clients on it who actually say it takes 2 to 5 minutes of their time. Once you practice it a few times, good news is within the app, you also have tutorial videos to guide you, and they're all on YouTube as well. But as I said, after 1 or 2 scans, you'll get it. You'll master it. The key is to really pull your retractors, really pull one side, and then push it to the other side. You can pull this cheek. So we got to really get as much retraction of the cheek as possible per side as you move around. So congratulations, you have already obviously seen us. You have already decided to go ahead. You are now about to start your treatment, or might have just started, and we're going to place attachments soon and actually see you physically in our office. Now, dental monitoring is a weekly monitoring system. It could be less than a week I want to monitor you, but most people are on a weekly cycle. Okay, so some people would be on a 10-day or 14-day cycle. Make sure you do not miss dental monitoring. It is very important because it is what continuously guides us and makes sure we finish predictably and fast for you, okay? So if you want a faster treatment with less unnecessary appointments, dental monitoring. Now, every now and then we will need to bring you in because something's not going well, or we need to fix something, or just check you, okay? If we can't understand the virtual 3D tracking, or something is not clear for us. Now, if we bring you in, usually we don't bring it unnecessarily. So usually every 4 to 6 months, we might bring you in. Usually around that time, we're also taking new photographs, new scan of your teeth, discussing what's happened, what hasn't happened, and then often getting you new aligners made up to continue the process. Because that movie that we send you of Invisalign aligners or Spark, whichever system you have chosen, that movie is a simulation. It doesn't mean every movement in there will happen. If some of the movements didn't happen, we're going to catch it at the next scan, okay? So it's very common for most people to have 2 to 3 revisions, maybe even up to 4 revisions to get a beautiful result, okay? We already know how long it takes. You have to wait about 2 or 3 weeks before you get new aligners. Don't worry about your treatment times. We already know the process, and we have estimated your treatment time based on all of the goes and the pauses and everything. Now, when you're finished, that is the most exciting part. We also have a retainer phase where we continue to monitor your retainers, and we can put you on dental monitoring and virtually measure if your teeth are moving or they're still and stable after your treatment finishes. We'll put some wires on your teeth if you're suitable for them. We'll give you also on top of that removable retainers that you're going to wear every night. And we'll try and look after you for at least the first year after your treatment, unless we have said we're going to look after you for longer. And you can choose to be on the virtual tracking month by month during your retainer wear. In case you're really concerned about teeth moving again, and we can discuss our retainer packages with you towards the end of your treatment, okay? But rest assured, you are in best hands. We are excited to see that result at the end. We have no doubt that you're gonna love your treatment. It's gonna be comfortable, fast. It's going to, in fact, most people say something to me. I've never had anybody turn around and say, I regret doing this. In fact, what most people say is, actually, I wish I'd done this sooner. Or after 3 months, it's after 3 months. Yeah, you don't hear this before 3 months. After 3 months, most people say, wow, I can see the results. And they're happy to keep going because they're so happy as their teeth are straightening. They actually don't feel like this treatment's going on too long. Most people are happy to continue. So rest assured, it'll feel really weird, but you're gonna get used to it. So I thank you for listening to me. You will have a hard copy of all of these instructions in writing as well. And if you need any help, CCC Smiles team is always there to help you. We're happy to get on virtual appointment with you. We're happy to bring you into our practice in Mosman or CBD and continue on. So I'm excited for you, and I look forward to seeing you again. And thank you for listening to me. Bye.